Welcome to the Pegasus Learning Platform. Pegasus is your home for clinical simulation and learning resources. This presentation is appropriate for content overview and clinical competency and will cover disorders of the posterior pituitary gland. Although the pituitary gland has an anterior portion and a posterior portion, this presentation will focus on disorders of the posterior pituitary. For a thorough understanding of the pituitary gland, further research and study are recommended. Before we can understand disorders of the posterior pituitary, we need to know what that gland does. The posterior pituitary secretes two important hormones, oxytocin, which we know as the feel-good hormone, and vasopressin. Vasopressin is the antidiuretic hormone, ADH, vital for controlling the body's ability to retain H2O, or water, a polar inorganic compound essential for cellular function. The human body cannot sustain life if it cannot retain water. Disorders of the posterior pituitary disrupt normal secretion of the gland and can lead to hyposecretion or hypersecretion of the gland's hormones. Diabetes insipidus, DI, occurs when the body does not make enough vasopressin. Syndrome of inappropriate antidiuretic hormone, SIADH, occurs when the body makes too much vasopressin. Understanding diabetes insipidus can be a little bit difficult if you confuse diabetes insipidus with diabetes mellitus, and they have nothing to do with each other. The word diabetes comes from the Greek word siphon or flow. They're talking about urinary output. And the word insipidus means tasteless or watered down. So in this case, diabetes insipidus means watered down urine. An easy way to remember that is to look at the letters SIP in the word insipidus, and it spells sip. If you say it backwards, it spells, well, piss. When a person develops diabetes insipidus, DI, due to hyposecretion of the hormone vasopressin, the body cannot retain enough water. You're going to see symptoms such as polyuria and polydipsia, which you saw in the word insipidus with sip and piss. The characteristics of the urine will change. You'll see clear, watery urine and a low urine-specific gravity. This in turn leads to weight loss because all they're taking in, they're urinating out. It leads to dehydration, poor skin turgor, hypotension, and can lead to vascular collapse. It's a little bit tricky because generally your patient with dehydration has dark concentrated urine due to poor fluid intake. In this case, they're taking in enough, they're just urinating it out. So you may see dehydration with clear urine. With diabetes insipidus, DI, the body cannot retain water. So your nursing interventions are going to address these issues. You're going to monitor I&O, monitor vital signs. Monitor skin turgor. Remember, they're at risk for dehydration. Monitor the characteristics of the urine. You'll need to monitor their weight and monitor labs. You'll also need to provide a safe environment. Maintain adequate fluid intake. Give them vasopressin, and your patient will need a medic alert bracelet. When a person develops SIADH due to hypersecretion of vasopressin, the body retains too much water. Symptoms such as low urinary output and anorexia occur. The characteristics of the urine will change as well. You'll see dark concentrated urine with a high urine-specific gravity. This in turn leads to fluid volume overload, hypertension, weight gain, and dilutional hyponatremia. You may see a change in mental status because they have hyponatremia. A low sodium can cause a change in mental status. They may also have hypertension, but still may need sodium because they have dilutional hyponatremia. With SIADH, the body retains too much water. So your interventions are going to address that. You'll monitor I&O, monitor vital signs, monitor characteristics of the urine, monitor weight, and monitor labs. You will also need to provide a safe environment. Maintain appropriate fluid intake. Sometimes they're on fluid restrictions. Remember, they retain too much water. You would give a vasopressin antagonist because they make too much vasopressin, and your patient may also need a medic alert bracelet. There are some interesting considerations for people with DI and SIADH. With DI, remember the word insipidus has sip and piss in it. They may be dehydrated with clear urine, so we need to always consider safety, and they will need a medic alert bracelet. If you can remember DI, not enough letters, not enough vasopressin. With SIADH, they may have hypertension and still need sodium because they have dilutional hyponatremia. We'll always consider safety, and they will need a medic alert bracelet. Remember, SIADH, too many letters, too much vasopressin. Please note that this is a brief overview only. This presentation is appropriate for review and continuing education. The care and treatment of patients with DI or SIADH involve more than this presentation covers. Thank you for your attention to this resource hosted on the Pegasus Learning Platform.